So, what are the risks of an ectopic pregnancy? The incidence of an ectopic pregnancy is about 2% of all pregnancies. The risk of recurrence is about 10 to 27% for those who had had a previous ectopic pregnancy. Now, it's important to understand the risk factors for recurrent ectopic pregnancy so that you'll be able to be informed much better. Now, the paper looks at the current knowledge of risk factors, diagnosis, and management of recurrent ectopic pregnancy. The risk factors are of previous tubal damage, evidence of infectious pelvic diseases, prior pelvic surgery, salpingostomy, infertility, lack of contraceptive use, first pregnancy at the age of 24 or under, history of repeated ectopic pregnancies. What are the protective? Protective is that multiparity is protective. The more children you have, the less chance of an ectopic pregnancy. The symptom to be slightly less in terms of having less bleeding sometimes with recurrent ectopic pregnancy, and that's one of the symptoms that is different from a normal ectopic pregnancy. For the management aspect, there are two mainly: surgical, you remove the tube or the ectopic pregnancy, or you look at medical treatment in the form of methotrexate. This was from the paper of International Journal for Women's Health 2020, and the topic was recurrent ectopic pregnancies, current perspectives. It's a nice paper to read, and that gives you a general idea of recurrent ectopic pregnancies.